So my contribution to Rural Healthy People 2030 was multifaceted. As the director of the Southwest Rural Health Research Center, I really sort of oversaw all components of the project. And I was really excited to work on this because it's been a tradition of ours in the center to work on rural healthy people. And so with the upcoming decade and the release of Healthy People 2030, we started thinking through what the survey needed to look like, who it needed to go out to, what the questions needed to be, who we needed to oversample, etc. So I was involved on that end. I also sort of thought through who our chapter contributors should be. And so I thought through with my team who the lead author should be, what expertise do we need them to have, who amongst our doctoral and master's level students could support the writing of those chapters and the research needed to go into those chapters. And then I also contributed in the writing of certain chapters. And so I contributed to the obesity chapter, the public health infrastructure chapter, but importantly, I led the housing and homes chapter, which I was really excited to do because for the first time in Healthy People history, housing and homes was its own goal and topic and had its own set of objectives. And so I contributed in that way. Something that was really interesting to me, and so much of it was for this chapter, but it was sort of thinking through the fact that homeownership is higher in rural areas and housing and homes tend to stay within families more so than they do in urban areas, and the research supports that. But when it came to sort of thinking about the cost of maintaining homes, so the energy costs, thinking about heating and cooling, thinking about repairs to the housing, thinking about the age of the housing, that's when we really started to see discrepancies in the financial resources it takes to maintain a home in urban areas relative to rural areas. And I also think that one of the things that we often take for granted in 2024 or in this decade is that we don't really have to worry about lead anymore. But there was so much research pointing to the fact that the rural structures, many of them, or a good proportion of them, were built prior to the ban that was put on lead-based paint. And so when we're thinking about where children live, the implications that are involved in terms of lead exposure, the developmental delays that can occur, those kinds of things, I think I was really surprised to see how much that shone through. And I hope that in reading this chapter, those that are involved in housing advocacy can really think that through and think about how we establish and maintain and ensure that lead abatement procedures are happening for rural communities. Another thing that really stood out to me was the literature's addressing of the proportion of rural residents that are homeless or unhoused. And what really stood out was the fact that we have lots of tools and mechanisms for capturing urban unhoused individuals. But when it comes to rural residents who are unhoused, it's a bit more difficult for us to come up with a number that is accurate. And that is because unhoused rural residents tend to be sort of out of sight. So we may find them in campgrounds, we may find them in canyons and other sort of mountain hollows, those kinds of areas. And so in thinking through what that means for policy, for practice, for advocacy, it means that we sort of have to develop ways and means to get to those individuals that are a bit different than the tools that we use for addressing homelessness or unhoused needs in urban settings. And so that really stood out to me. By 2030, my hope is that we've normalized the power that can come when we involve rural communities and residents themselves, have their voices be heard, really take stock of their resilience, their resourcefulness, their innovation in meeting the challenges and really helping to improve housing and homes for rural communities. One of the things that really stood out when we were researching the previous work for this chapter was just the power that comes with those kinds of collaborations and having efforts that are not happening in silos, but really sort of thinking through who are all the stakeholders that need to be involved, including the rural residents themselves. I think that would be amazing if we, as a no-brainer in 2030, just know that that is the way to go if we want to see and really move the needle on housing and home improvements. In thinking about the Rural Healthy People 2030 publication as a whole, my hope is that for those seeking to really move the needle on population and health improvements for rural communities, we'll use this as a tool and as a way to really understand what the needs are of rural communities so that our resources and efforts are being conducted in expedient and efficient ways so that we can address and reach some of the goals that we have highlighted for 2030.
This concludes the end of our Rural Healthy People 2030 interview series. If you would like to download or order a free copy of the edition, please go to srhrc.tamu.edu. Thank you for watching.